Yes, I'm Dr. David Eseru. I work with the National Drug Authority, Northern Regional Office, which is based in Lira, as a regulatory officer. And today we are having a sensitization, a training for animal health workers, both the private and the public animal health practitioners. Now this follows sensitization meetings which we have been having at sub-county. We did sensitization in 8 sub-counties, and now we're concluding with this sensitization, with this training. But the purpose of this is basically to improve on animal health through ensuring proper use of veterinary drugs. As you're aware, NDA regulates veterinary drugs and also human drugs, but our focus today is on vet drugs. We want to ensure that animal health is improved, so that productivity also is improved, and then the livelihoods of our community that largely depend on livestock also can improve. So we interacted with a number of farmers at sub-county level, from where we were trying to get an understanding of what NDA does, but also the disease situation, and then the drug use situation in the district, and then any complaints regarding the veterinary drugs which are available, but also the scope of the drugs, the commonly used drugs. Now our finding was that, first of all, most farmers have livestock, and the most commonly kept livestock here was poultry, followed by goats, and then cattle, then pigs. There are also dogs, and then the cats. Some small animals like the rabbits and the guinea pigs were there. So as NDA, we're really interested in ensuring that animals are healthy, so that even what we consume, the food that we consume, should be wholesome, free of drug residues. So if the animals are really healthy, most likely we'll also have foods which are not contaminated with the drug residues. Now the challenge we had was that knowledge. Most of the farmers had inadequate knowledge, and then veterinary services, and then access to drugs was a big challenge. In the 8 sub-counties that we visited, it was only one which had a drug shop. So that means farmers are accessing drugs from sources that we are not very sure of. But we encourage farmers to access quality drugs from licensed veterinary drug outlets. Those are sources that we are sure of, where the storage conditions are okay. But these drugs where they're accessing from homes, there's that practice of going to a neighbor and then borrowing used drugs which have not been kept well. Now those drugs are not very effective. So we are encouraging even the practitioners, that's why we're having this training, to open up drug outlets so that farmers can access quality drugs to improve on the health of their animals.
This training has been a week-long activity. We started on a Monday with the Oram sub-county and Namukora, and it is ending today with the veterinary extension service providers. The ones that are working under district local government and the ones that are practicing privately. It also includes veterinary drug shop owners. The benefits of having such training are twofold. One is to learn from the farmer's perspective. One, on the diseases they commonly encounter, from the clinical signs that they see, can guide us on which disease is the most common in their area. We have visited 8 sub-counties, Orom, Namukora, Nyima, Muchini, Nagoro, Kikumadidi, Amida, Kwang, and then today we are ending with the extension staff. So that one can guide us on which disease is the most prevalent and which disease is the least prevalent. In our discussion with these lead farmers, we also sought to know the most common livestock that they keep at their places. So it turned out chicken is the most commonly kept livestock among the farming communities in Kitgum, followed by goats and cattle. Chicken actually became a priority because majorly in most households, chicken responsibility of taking care of them are left to women and children. And secondly, chicken, they grow faster and they fetch money earlier. And if you can bear me witness, Christmas has just passed. The prices for chicken went up. And with this current school opening, is a source of money to most households. So we get to know the most common diseases. We also get to know their knowledge towards veterinary drug. Which drug do they commonly use in treatment and control of these various diseases? And where is the source of this drug? Do they buy from drug shops? Do they borrow from neighbors? Do they buy from hawkers, if any, in the villages? Do they buy from auctions, if any? But we learned that most source of these drugs are actually from veterinary drug shop. And we also learned to find out the accessibility of this drug, where we found out in most of these sub-counties there are no veterinary drug shops. That means there are limited access to these drugs by these farmers. Yet, livestock population are increasing. So in our field tour, we also encourage farmers whose children studied veterinary science to open up drug shops because they have the rightful qualification to improve on availability and access of this drug by these farmers. Because it will become very costly for a farmer in Oran, for example, to ride all the way to Kitgum town to buy a drug to treat his animal. And yet those costs would be minimized if there is a drug shop in Oran sub-county where you can just move a short distance and buy.
Director, my life vet drug shop, opposite Babama ground, you the police. Banlobo, Chokamatin Prajo, Menas of Drug Authority, K Ministry, teams, my veterinary practitioners, I take Kitgum district. Men look, carry me a poignant of Borge. One poor mother been in a pian, become a large, a gym in a petty man, make kilo, veterinary practitioners, then Kitgum Magatigi animal drug shops, a Kitgum. Come you point your Borge, you may look at cartel, you move your tongue, king on my challenges, Magatiki. Pian Kubete Wero. One sharing a third time cartel, pian, you know, John animal drug shops come out biddy ye, you kill my ticket, petty kidman of America, Tara, if Puno Obedi and a drug shop march and in your Romano take Cotido district. Ma, you carry cures, and yet, ya told me to be the cures. Give me a team pian, they are not being sensitized. Get pecking yagi, pecking it more can here. Came come any. Kubeti me where referrals channels pian ka in vet level of paying ka check ginma key field you refer it to the next person. From certificate you refer to a diploma holder can refer to a degree holder. No where could pay kinti to megwa warm bear doc services mano pu take a merno nek porto one machalo vet gino kinomir bet kere doc medical any lema megwa Peto ta ikarma gitia konyogi dokiro ko mabe pian ka chek mono nga in ka pe referring yo mono kana pe me nyu do mi le no to mere kom eni yat maka chek tuju gi le o mi le ni ko bet pe karmona put pe ak nego ni put pe ak charo ma nega ko mi ro bedi pi piros mane to tale ni na ngwen yo kercha bera chel yaro gi nego any catch a pecking me point, pecking me on Podano, levels me pan up a part away. Chi, we have Kino Can Dano, Bidaka Chamo Yare Comgi, we have two Mukan no pole, or Nogi cum le, Unomiro, Power Nongi, Pian, Power taking it, cum Jim or Tigi.
The veterinary drug regulation and on the side of the regional manager, I presented on the mandate of NDA, which is to ensure that all Ugandans with their animals ensure safe, efficacious and cost-effective human and veterinary drugs. I took people through how NDA came up. NDA we are mandated by the Act of Parliament of the Republic of Uganda, Chapter 203, and amongst the various roles that we play at a regional level are inspection and licensing of drug outlets, that is the drug shops and pharmacies. Those who already have drug shops, be it veterinary or human, they should be aware that the license that they have with them is already expired, and we are encouraging them to renew. And basing on that, we shall be having a meeting, sensitization meeting with the drug outlet operators at Little Palace Hotel in Kitgum, where we shall sensitize them and then distribute the application forms for licensing of drug shops. And those who intend also to start a new one, you are equally invited. We shall be also taking you through what is required of you. My last word to members of the public, I have three concerns. First, the first one is to members of the public. Please always buy your drugs from a licensed outlet by National Drug Authority. Secondly, it is your right to ask the person who is serving you to show you the medicine and see that it is not expired. It is still viable. Because there are some people who wants to supply, much as the drug is expired, they still have this feeling that much as the drug is expired, it can still be used for some time. But the expiry date is determined by the manufacturer using a study. If they say that it's expiring on the 30th of January of this particular year, it has to be that. So early pass out by checking on the expiry date, and still to the members of the public, also be vigilant and help us in checking drugs which you suspect may be a counterfeit. This was a big challenge, Uganda being a porous border. And then to our operators outside there, let us desist from buying drugs, these cheap drugs from the hawkers. In most cases they are counterfeit, they are fake. And please, if you know you're selling drugs without a license, you're committing a very big crime, and the law is very clear. If we get you illegal possession of classified drugs without a license, you're liable to a fine of 5 million shillings, 2 million shillings, or imprisonment for 5 years, or both. And then if you're working with the government, you'll lose your job. You'll be blacklisted by NDA. We shall never allow you to sell drugs. Please make sure that you get a license before you enter into sale of drugs.